Why is it essential to review patient records prior to the visit? Now, looking at this question, and maybe you already glanced at the answer choices, there's something important to keep in mind. The main underlying theme and the purpose for all of these questions on the medical assistant exam are a few key points. Ultimately, they want to make sure that you're keeping patients safe, so safety. And they also want to make sure that we have accuracy. And overall, the whole idea for all of these things is to have the best health outcomes. So best health outcomes for our patients, meaning that we have the most accurate and the most safe results. So our patients stay safe and they stay healthy and they have a good care experience. Therefore, when you see a question like this, why is it essential to review patient records prior to the visit? Your answer choice should reflect this and should reflect the accuracy and the safety and ultimately everything you're doing to benefit the patient to the best of your ability. Therefore, looking at option A, when it says to ensure billing accuracy, typically these types of questions are not looking for something financial and they're not looking for something billing related. They're looking for something that has to do with the patient experience and having the best safety and accuracy outcomes. They're not focusing on the billing in a question like this. They're focusing on the patient care. Therefore, option A we could eliminate because that's not what the question's looking for. Option B says to ensure healthcare is comprehensively addressed. And that would be correct because if you're looking at the patient's records prior to a visit, you want to see what kind of history they have. What did they come here for last? You could follow up on any issues that they previously came in with. You could have an idea of their health history, so you could keep that in mind when you best take care of the patient. Everything is for the overall well-rounded patient care experience. Therefore, option B is looking like a good choice. So let's put that, but let's look at the other options. Option C, to update the patient's contact information. And we're looking for the overall reason you would be looking at these records. Ultimately, everything has to come back to safety and accuracy. And although, yes, maybe it is important to review the patient's contact information, that's not the main reason to review the patient records. And usually the records have to do with the patient's health information. The contact information could come after once they're here. We could review that with the patient. This is asking why we would review the record prior to them coming in at all. So we can eliminate option C. And then option D says to check the patient's insurance status. And the insurance status goes along with billing accuracy. You might notice on this exam that sometimes you have two choices that are very similar, and they could both be similar in the sense that they're both incorrect for a similar reason. So in this case, the billing accuracy and the insurance status, those are different. Those are not directly linked as much with the safety and the accuracy that this exam is stressing so much. And therefore, we could eliminate option D. And that leaves us with option B, to ensure healthcare is comprehensively addressed.